Hello everyone, how are you today? Today we are going to discuss another question for MRCS exam. Here is the question. Let's start the question here. Which of the following is not true of hyperacute solid organ transplant rejection? So in the below first option, we have to find out which statement is not true in case of hyperacute rejection. Hyperacute solid organ rejection. Here the options are: it may occur during the surgical procedure itself, may occur as a result of blood group A, B or O incompatibility, may be due to pre-existing anti-HLA antibodies. One biopsy will typically show neointimal hyperplasia of the donor arterioles, and complement system activation is one of the key mediators. So we have to find out what about hyperacute rejection and the component of hyperacute rejection. So here we can see the types of graft rejection: hyperacute, acute and chronic. There are three types of graft rejection. In case of hyperacute rejection, it occurs immediately during the operation, and acute, it occurs within the first 6 months, and chronic, it occurs after the 6 months of transplantation. And hyperacute rejection, it occurs due to preformed antibody such as ABO incompatibility or HLA incompatibility. And acute case, it occurs due to tissue infiltration and vascular lesion, and chronic, it occurs due to vascular changes. So in hyperacute graft rejection, we can see immediately during operation. So here the correct answer is: one biopsy will typically show neointimal hyperplasia of the donor arteriole. It is not possible in case of hyperacute rejection, because hyperacute rejection, it occurs during the operation table. So other option we can see here: it may occur during the surgical procedure itself. Yes, it can be occur. May occur as a result of blood group A, B, O or O incompatibility. Yes, it can be occur due to A, B or O incompatibility or HLA incompatibility. May be due to pre-existing anti-HLA antibody. Yes, it can be occur due to pre-existing antibodies. And complement system activation is one of the key modalities for any type of immediate reaction. Complement activation is the one of the mandatory option. And one biopsy typically show neointimal hyperplasia. It is not possible because neointimal hyperplasia, it requires a longer time to develop with development of the hypertension of the recipient. Thank you all.